everyone, my name is Adrianna Williams. Like Sarah said, I'm a rising senior studying neuroscience at Duke, and today I'm going to be talking to you all about to better educate our peers and our family on appropriate public health measures to help keep us all safe and healthy and free of COVID. And with the Duke-Margolis Center for Health Policy being established in 2016, COVID-19 is one of the first pandemics our center has responded to. And our COVID-19 response includes the following: responding comprehensively to the pandemic, helping to reopen the nation successfully, and working to create a more secure health system. And to disseminate our research to help us with these goals, we've developed a thorough communication strategy. So with this in mind, my research question is, how has our communication been affected by the COVID-19 outbreak? To determine this, I've conducted analyses of 3 mediums we use to disseminate information: our website, news coverage, and Twitter. Specifically, I did a statistical analysis of multiple website metrics via Google Analytics, along with statistical analysis of Twitter metrics. I've conducted also a thorough qualitative analysis of our news and media coverage by coding local, regional, national, and international articles and news spots that feature Margolis faculty and leadership by a variety of COVID-19 and other health policy topics. All the data was also grouped into 2 main categories: pre-COVID-19 outbreak and post-COVID-19 outbreak, as you see on the slides. And so for the purposes of this study, I'm referencing December 31st, 2019, the date we first saw COVID-19 cases, as the point of COVID-19 outbreak. Overall, across all the data, we saw statistically significant increases in our communication since COVID-19 started. Specifically with our website, we saw significant increases in percent of news sessions across countries and age. And moreover, a general trend that I noticed with our COVID-19 publications is that we're seeing less users between the ages of 18 and 35 viewing these publications than individuals who are 36 and older. Moreover, moving on to social media and Twitter specifically, again, we're seeing more tweets and specifically more tweet impressions since our COVID-19 outbreak. And finally, going to my qualitative analysis of media coverage. Again, we're seeing Margolis faculty and leadership in more interviews, articles, video interviews, so on and so forth since COVID-19. Specifically, what we're seeing when we look at COVID-19 topics that we're discussing COVID testing, social distancing, and contact tracing the most. And something else that was really interesting that I found was that there is a subset of health policy topics that we've been discussing since COVID-19 started and even before COVID-19 started. And so those topics we're discussing payment and delivery reform, health insurance, and Medicaid/Medicare the most in conjunction with or alongside COVID-19. So what does all of this data mean? First, it shows that we're doing a great job of increasing our communication and press since the COVID-19 outbreak, and we've been able to keep many of our portfolio topics in conversation with COVID-19 while also shifting much of our focus to COVID-19. Finally, the Margolis Center should explore new strategies to reach 18 to 34-year-olds more effectively, given that they're a group with a high infection rate at this time. And these are my references, and thank you all so much, and I'll take questions.
Great, thank you. So want to just open up and see if anyone had any questions for Adrianna in terms of the work that she's been working on this summer.
Adrianna, I have a question. This is Charlene. You know, interesting to see the age breakdown of the impressions. What's your thought on what a strategy would be to increase views by younger people? We know that they're a group that we're seeing the fastest rise in cases in, particularly with our students getting ready to come back to campuses and such. So what are your thoughts there?
Yeah, that's a great question. I think that we have to really look at where we see 18 to 34-year-olds receiving information and meet them there rather than trying to have our information just accessible on places such as our website. So for example, just from my personal experience, a lot of people my age and a little bit older receive a lot of our information about COVID-19, both from unfortunately from Instagram and from Twitter, but we have to really look at and reconsider how we make our Twitter account or even our Instagram account more engaging to students, especially Duke students, so that they can receive the information and receive accurate and clear information. Because again, from the data that I saw from our Twitter account, while we are tweeting a lot about COVID-19 and that's important, a lot of 18 to 34 year olds, aren't receiving that information, or not as much as people 35 or 36 and older. So I think it's going to require us to really reconsider how we take our social media and use different tools like Twitter, maybe Twitter ads or Twitter engagement tools to meet 18 to 34 year olds where they are. And I think another thing that we can, yeah.
Sorry. No, I was just going to say, I think, Mark, you have a quick question as well.
Yeah, thanks. Can you hear me?
Yep.
Yes.
Yeah. Okay. So first of all, I think Charlene needs to do a TikTok video sometime soon to get us
only
connected
with
to that
you, only
crowd.
if you're in it, Mark.
And the other question was kind of along the same lines, Adrianna. Any other suggestions you have about ways that we can improve our media impact, maybe with other groups?
So I think another thing that that I've thought about is sort of using people in our center, faculty, leadership, even interns, to share our information. One thing that I've found is that it's one thing for us to share COVID-19 information and like just see who will receive it, but it's another thing to use the people in our center and use our own like personal or our own networks to share that information, and doing that creates more impact. So for example, with younger people, one thing that I've thought of is, either creating a campaign, a video, social media, however, using the interns in our center to talk about COVID-19 and talk about, good public health measures. Or using, again, other people in the center to create and disseminate this information and share with their own networks. Because again, at the end of the day, when we are not just relying on our Margolis network, but relying on our own individual networks within our center to share this information, it'll go a lot farther.